COVID-19 is devastating communities of color. Can vaccines counter racial inequity? And that's probably it. That's all we need to see for here.
Actually, Zach, would you put up the
I've got
screenshot of the New York Times? Yeah, here we go.
So this is from a piece in the New York Times that was published on December 5th, but updated December 15th. So it's been reviewed recently.
And it says, Harold Schmidt, an expert in ethics and health policy at the University of Pennsylvania, said that it is reasonable to put essential workers ahead of older adults, given their risks, and that they are disproportionately minorities. Older populations are whiter, Dr. Schmidt said. Society is structured in a way that enables them to live longer. Instead of giving additional health benefits to those who already had more of them, we can start to level the playing field a bit. So, how many different ways is this wrong? It's pretty spectacular that we would be playing this out. I will say, actually, it's very fitting following on our corrections. I'm going to say I predicted this one because I said, where is this all going? It's going to go to reparations in every interaction at every scale. 24 hours a day, 7 days a week, 365 days a year. And that's effectively what this is that people are being programmed such that any place where you could distribute things differently based on race, it's assumed to be a good thing.
And it's just, there are a couple of demographic markers that everyone seems compelled to elevate at every other cost at the moment, pushing that one slider all the way to maximum, thus reducing outcomes, minimizing the effects of these decisions on outcomes for every other possible category, not just within that category. Obviously, it's going to have health effects on older white adults, but it also means that there are going to be effects for everyone else. Hey, we've got a visitor for the first time in a while here.
A visitor who very definitely has adaptive immunity.
Yes, he does.
So I don't exactly know where you all are headed here. I know there's some things about this.
I am multitudes now?
Yes, I believe we all are. But anyway.
I don't think you've ever called me you all before.
It was you all, two separate words, so I think I'm on safe ground. But
go for it.
But in any case, to be clear, the CDC, and most of what we know, I think, comes from a slide deck in which they presented this material, and they go through an analysis. It's not a super high quality analysis, but it's sort of.
You want to just show a little bit?
Yeah, you want to show a little bit. They do their little matrix thing. You want to, Zach? You want
to? I have it on my screen, Zach. There we go.
Okay, you want to scroll up.
Okay, so this is coming out.
Oh, then we can't scroll. Please. All right. So let's get down to so here they're basically arguing that there are 3 different categories competing. They're alluding to trade-offs, I think, kind of ham-fistedly, but nonetheless.
They're alluding to trade-offs, but I would also point out that this once again reminds us that the sort of the hashtag slogans that are accompanying the culture wars always pretend that there are no trade-offs. So, the one that, that I've talked about most in the past is hashtag believe all women, really all the time, no matter what they're saying under any circumstances, right? And then another one is it follow the science? What is it?
Yeah.
Something about always trust the science under all circumstances, no matter what. And here we have, no. And this is not what they're doing. They are recognizing, frankly, that there are trade-offs and that they're not just going to follow the science at all moments.
Yes.
You want me to scroll down some more?
Yeah, I do want you to scroll down some more. I mean, I fully believe that actually the science doesn't, it depends how you categorize the science. Right. But the science doesn't answer the question what you should do. It can, if it's done right, it can answer the question of what is the case, what are the facts. But then the ethical part is distinct.
Yeah. But okay. So under ethics, they've got promote justice, by which, of course, they mean promote social justice, by which, of course, they mean capital S, capital J, 2020 brand social justice, which is about equity and not about equality.
So let us be really clear here. In some sense, they are arguing for race-based medical triage, right? Triage being the mechanism whereby when you don't have the resources to save everybody, as in on a battlefield situation, you prioritize those who are best able to make use of what efforts you have, and you may let people die who could be saved because it's a required phenomenon. The question is, race-based triage? Really?
Yeah.
That's how we're going to do this?
Yeah.
Okay.
So, okay, go on.
No, go ahead. I was gonna. Did you stop here for a reason?
No, I just have a couple more things to say on the subject, but go for it.
No, go for it.
There are a couple of things. I'm going to need my screen back here, Zach. There are a couple of things that this reminds me of, and one of them is a word that we said at the same moment when we were talking about it this morning, which is Tuskegee. Like the Tuskegee syphilis study, which started in, 1932, targeted Black men and allowed Black men to die of syphilis even long after treatment was known and available, even long after I think it was penicillin was understood to be treatment for it. And, in fact, I went back and looked at the New York Times, which is, quoting this health expert saying that we should not give the vaccine to older people because they're primarily white first. The New York Times back in 97 and earlier also did a good job explaining why this Tuskegee was appalling, right? And everything in what the CDC is saying in the slide deck now is not only race-based, but presumes that the vaccine is an unalloyed good, that there is no question at all about sure efficacy, but primarily safety. And if there is anything to the many concerns that have been raised, very few of which are saying, oh, the mRNA vaccine is bad, most of which are saying, like we did last week, we cannot know yet, then what if by actually doing race-based medicine here, we are repeating something like what was done in the early 20th century?
So,
I mean, it's frankly completely appalling.
It's
racist either way. And just one more thing to that end, because we don't know the long-term effects of the vaccine, and because there is reason to think that there might be long-term effects of the vaccine, that is actually another reason to prioritize older people in getting the vaccine, not only because they are more likely to have very bad outcomes from it, but because if there are very long-term effects of the vaccine, they are less likely to be revealed in those people.
Yeah. The thing here is, this is an experiment being run at a scale that, is it fair to say that there has never been, at least medically speaking, it's going to be hard to come up with a case in which there was a broader scale experiment in long-term consequences. Maybe there is something, but the degree to which this is rapid deployment of something novel that doesn't mirror anything we have experience with, in the absence of any mechanism that might tell us what the long-term consequences are. This is an experiment being run at an unprecedented scale. Mm-hmm. And the idea that based on race, people are going to be advanced in this cannot help but imply that at some level we are willing to run that experiment first on people because they've been disadvantaged, which, it's a gamble. Could it be that being high on the list of the vaccine ends up working out for you? Of course it could be. This vaccine could be just as promising.
Let us hope that everyone who receives the vaccine gets a health boost from it.
Gets a health boost, that the immediate side effects are low, and that the long-term, there's lots not known here, including whether or not this has any positive effect on transmission. Right.
Explicitly not known at all.
Explicitly not known. So
may provide some immunity for the person getting it, but whether or not, if they have it, they're less likely to transmit it, we know nothing.
Yeah. So anyway, this is an argument that in this context, I believe completely accidentally amounts to running an experiment on disadvantaged people. That's their argument. By giving them the vaccine first, while we are effectively lying to ourselves about how much we know about how safe it is.
Yeah.
So yes, echoes of Tuskegee indeed. All right, can you scroll further down in there? So they have this matrix analysis here: science, implementation, ethics. They've got mysteries here, and then as you go through the slide deck, they fill these things in and they give ranks, and it's all very pseudo-quantified.
Yeah.
So they begin to fill these things in. And as they do it, what they reason, so this is their reasoning, whether true or not, is that
Just
prioritizing.
hold on. For people who are listening and not watching, it's a matrix of 3 columns, 3 rows: science, implementation, and ethics, that same little diagram that shows up throughout. And then the columns are essential workers, non-healthcare, about 87 million people. This is US. Adults with high-risk medical conditions, over 100 million. Incidentally, high-risk medical conditions includes obesity and either former or current smoker, which is how that number is so big. And adults age over at 65 or over years of age, 53 million.
Right. Okay. So the result, if you scroll down, we got one more, another matrix. There it is. So here's how they have, oh no.
Nope.
This is a different matrix. Well, this is becoming confused, but let's just say the
Yeah,
sum
it is.
total of what they did was determine that they would save more lives if they gave it to the elderly.
Yes.
But
Yes,
that
they
the
did.
ethical implications, as they read them, suggest that there is a reason, in spite of the fact that we would save more lives if we gave them to the elderly, to prioritize essential workers first. Now, so there is, as there is an echo of Tuskegee here, there is an echo of eugenics here too, right?
Yep.
There is, if we read that, in the 30s, that there had been a terrible flu in Germany or in Europe, and that the Nazis had decided to deny Jews vaccines, right? We'd understand it completely. It would fit perfectly with that story. We would understand it as what it was. And then in this case, because everything's on its head, you've got a kind of nonsense that sort of superficially, well, these people are more disadvantaged, therefore priority to the vaccine levels the playing field. Even that language is kind of creepy.
Yeah, I mean, and it is the same language of old school racists, and specifically anti-Semites. Look at how much the Jews have gotten in the world, and we need to take from them what they have that isn't rightfully theirs.
Right, they have advantages, so therefore.
I mean, it's very much the same language.
Right. So now at the bottom, I've done a lot of thinking about this, and the question is there anything at all to what they're trying to do? Mm-hmm. Is there some hint of reality under this? And I sort of think, look, if you made the argument that there are some neighborhoods, for example, that have been disproportionately hit because for whatever reason, the way they get to work puts them in danger. People who have been watching our live streams will remember the subway issue and the issue of local trains versus express trains, right? There are certain places you can live that put you in danger, and those things, whether you're in danger based on where you live or where you work, is not evenly distributed by race. Were they to say, look, we are going to deploy these vaccines in the places where they stand to do the most good, and that happens to be racially biased, I wouldn't have an objection to it, right? Yep. But the idea that, you're going to categorize all of these essential workers, right? Okay, so now you've prioritized essential workers over people who are even more disadvantaged and don't have a job, from the same neighborhood. Why did you do that, right? If you're really trying to correct a disadvantage with a vaccine, which doesn't make sense, right? Then the point is you've done it so clumsily that it can't be defended. And, we're at neighborhoods, were we going to guess that not only does immunity to the disease come from the vaccine, but that immunity to transmitting it also comes from the vaccine, and therefore we will do more good if we deploy it in a neighborhood that has less control over the spread of this thing because people are packed densely together or something like that. You can make a perfectly valid bioethical argument for it. But
even though there are a couple of logical leaps there that aren't founded yet, just because no one has bothered to figure out.
But they're not, you could imagine that look, I think chances are that if we understand the vaccines correctly in terms of what they do, that they are also highly likely to reduce transmission, right? It's not certain.
I hope.
Yeah, well, it's not certain, but the point is, there are reasons that you could imagine that would likely fall. We just don't know yet. Right. So you could build a policy that would protect those who are most likely, protect communities that are most likely to have this thing spreading in an uncontrolled fashion, and that would be racially biased. But to put race first in their analysis, this is the road to hell.
Yeah, I agree.